Hello, thank you so much, Edward, for joining us on a podcast at Dawdle. And
Thank you for inviting me.
so, Edward, to start the podcast, to break the ice, why not you take 1 minute or 2 minutes and kind of give an introduction about yourself, your experience so far, and your journey so far?
Yeah, I am in AI and AGI area. AGI means artificial general intelligence. For 10 years, 5 years ago, I started consolidating the best minds in AGI. I presented so-called emerging AI technology rating at Davos Forum. And since then, I am developing international collaboration on AGI around artificial superintelligence, which we are building in international alliance of
Yes.
best minds in this area, because only international collaboration can reach AGI level. No one single company can do it, only international collaboration, because you need a lot of different technologies in AGI. You need not only LLM transformer, but you need neuroscience, you need quantum, you need a lot of actually 10 different technologies in this AGI architecture we are building now.
Now, the first topic that I would like to pick your mind on is what is Meta Alliance and how is this model, beneficial to the members globally?
Yeah, Meta Alliance is a partnership of 10 companies which have 10 different elements of AGI. And together we can reach this AGI level first in the world. Because as I told you, no one single company, even Microsoft, even Google, has AGI technology because it is so complex technology. And Meta Alliance unites all these 10 companies with their different elements of AGI technology. And we are doing this R&D, research and development. We are doing technology transfer. We are doing creation of think tank, because AGI need also to have theoretical base. What is consciousness? How this consciousness can translate into a computer? How you can raise artificial superintelligence, human level consciousness in computer? So it is a big challenge, both theoretical and practical, technical, and we combine all these elements in Meta Alliance.
Got it. So it's kind of a partnership amongst all the different companies who are working on LLMs
Right. It is
so that
partnership.
they can all learn from each other and can improve the intelligence level of. Am I right?
Absolutely. Yeah, it is international technology transfer. So many countries. We have companies from India, from Emirates, from USA, from Europe, and we do this technology transfer. We call it sharing economy, because only when you share your
Yes.
information, it
Yeah,
increase, and you
absolutely.
don't lose your information. You keep your information, but also your partners.
Absolutely. Such a nice line that you told, Edward, is that, the knowledge increases by spreading it, not by keeping it to yourself. Now, I'll go to the question that, how is AI transforming the medical space as per you? Like, since you have been seeing a lot of huge cases, and what role that your platform plays in accelerating this transformation?
Yeah, thank you for this question, because healthcare is my passion. It is
Yes.
personal to me because my mother died because of lack of proper diagnostics, and I said myself that I should make all possible
Mm.
to prevent other people to die from lack of diagnostic which is already available, but you just need to share this technology between countries in order to save lives. So our Meta Alliance was built around the idea of health diagnostics, prediction of health risks. And one of companies in our alliance, actually my personal company called Checkup AI, it is a medical diagnostic company. We
Yes.
are predicting health issues by selfie. So you just take your
Mm.
smartphone, make selfie by tongue like that, because tongue diagnostics is
Yes.
actually
A very
also,
important one. Yes,
yeah,
yes,
from India, from Ayurveda.
yes.
So we
It
have,
talks a lot about your digestive system. It talks a lot about your kidneys and all,
yeah,
right?
absolutely. So Health Protector, it is our product, our AGI technology will be first used in healthcare, building this Health Protector, which will first predict your health risks immediately, like in 1 second, because you are keeping your smartphone every day for like 8 hours in
Yes.
a row. You are looking in your smartphone, and your smartphone can take the information and prevent your health issues.
Got it. And it can also be directly integrated with healthcare providers to basically
Yeah,
know about
that
the
is
status of health.
that is the main idea why we are calling it sharing economy, because this information from health diagnostic will be shared with health insurance
Yes.
companies,
Insurance
helping
company.
them to prevent your health issues. So economy which insurance company is making by preventing your
Yes.
health problems will be shared with you. So instead of paying more to insurance company is making economy and share back part
Yes.
of money.
Absolutely. That's a very noble as well as good idea as well, because you see a lot of parents in India, I see, like, a lot of them are living alone. There is nobody to take care of them, and that's kind of developing into an epidemic across the globe. Like even in Europe, if you go, like, the old people are all alone. Nobody's there to take care of them, and such kind of tools coming in will really help them and lead a good life. Yeah,
Yeah. So it is also mental health.
yeah,
This company Checkup AI was born during pandemic, when the pandemic of not only COVID but also of loneliness,
yes,
because people were all these quarantine issues happened, and a lot of mental health issues.
yes.
So our AGI also helping with mental health. It is your
Hmm.
best friend.
And how is it helping in the mental health space?
Yeah, you can just talk with Checkup and
Okay.
share your psychology problems or your personal problems in school, in your personal life, and this AI assistant provide
Yes,
the best assistance, even better than professional
yes,
psychology or therapist.
yes. Yeah, absolutely, Miss. I kind of regularly take these therapy sessions. Like once in a month, I keep on taking these therapy sessions, and this has helped me a lot. In terms of actually identifying why these emotions are coming, the logic behind it. Because suppose I still remember one of the counselor telling us that, when you get angry, you don't actually get angry. It's something else which is being getting triggered. Maybe
Yeah. Yes.
anxiety, insecurity, anything else, right? So, so I think this is the need of the day, and I see a lot of, especially the generation Z, which is coming, right? I think from a very young age, 16, 14 years, these people are suffering from anxiety, and they're not happy yet,
Yeah, a
actually.
lot of issue will arise when AI will take over jobs,
Yes,
because it automate a lot of things, and robotics, for example, they will take even physical jobs.
yes.
For example, taxi drivers,
Ah,
when all these self-driving cars will
yes,
come. So people will need consolation, and will need so-called universal basic income. That
yeah,
is our main idea. Money which AI will save, for example, for insurance companies,
yes,
will get back to users, and it is a sort of basic income for people who are losing jobs, who are losing hope.
yes.
So our goal is to transform not only technical but also societal, all the economy, and to provide so-called universal basic income.
Absolutely. That's again a good idea. A lot of people may call it to be a socialist idea, but it's still a good one because you're right. Like, 80% of the people are at middle pyramid or lower than that,
Yeah,
these people need.
my co-founder in Meta Alliance, Brett King, he is futurist and author of a book called Technosocialism,
Yes.
and he proved that
Yeah.
so-called technosocialism, meaning sharing the revenue generated by AI, sharing
Yeah.
back to society. So
Yes.
this is inevitable. All countries will adopt such revenue sharing mechanism because progress is going into this area of AGI. Robots will work and
Yes.
revenue should be shared with people.
Yes. Now, the next thing is that, what are the biggest challenges that, you have seen while bringing, while basically building this global sharing economy platform that spans across multiple continents and industries?
The main issue is just to make trade-off, to agree with people of different culture, different countries, to agree on the same mission of safe AGI. Because AGI can be evil. You know, evil. Elon Musk, 10 years ago, he created OpenAI in order
Yes.
to prevent bad outcome of AGI.
Yes.
So we need this collaboration, and my challenge is to convince people to collaborate, not to keep technology for themselves, but share with international community, and in this way, all will win.
Yes. And there are multiple challenges, like, you have data security challenges, then, you have challenges related to it
Uh,
should not affect their
this
revenue.
challenge is solved. We have a technology called Hypergraph Transaction Protocol, and it has solved the data security problem. It is 100% secure, and it is used by American CDC, Center for Disease Control. So we
Yes.
have this powerful technology uh, as the base of our AGI infrastructure.
And what is this hypergraph? I got, this is for the first time.
Yeah, Hypergraph Transaction Protocol was invented by American professor from Georgetown University,
Yeah.
and we license this technology, which is also already used by American Center for Disease Control. So they have 100% secure data transaction and data privacy secured because data is not even taken from patient. It's
Yes.
just the representation of data. So
Yes.
it is like
Got it.
anonymous.
Yes. Got it. And this is very helpful actually, because I was talking to one person who is working with JP Morgan Chase. Like, they're also working on something which kind of doesn't expose the name of the patients and kind of help in drug delivery. I think it was something related to drug delivery, like, where they use that data to basically identify what is the impact of the drug and how is it working out and all those things.
Yeah. For example, in America, there are now a sort of movement led by Mark Cuban and also supported by American head of healthcare, GFK,
Yeah.
Mr. Kennedy.
Yes.
And the goal is to make more personalized
Yes.
drug delivery
Yes.
and in this way to lower the costs.
That's called genomic medicine, I think, Edward. Like, that is mapped to the genes of a person, like medicines which are being mapped.
Yeah, now if we are talking about personalized, precise medicine, we are raising another one project of USA, actually not USA, but it is international project called Stargate. It is $500 billion project. It was presented by President Trump and backed by Arab countries in terms of investment. And the goal is to make personalized health diagnostics and gene therapy, personalized gene therapy, even for cancer.
Yes. When it comes to cancer, like, what are the main, emerging trends, especially in terms of technology interventions, which is helping prevent cancer or related disease, if you want to throw light on that?
Yeah, very good question. By the way, one company in our alliance is India rooted. It is called Version, and it is doing personalized medicine, 4P medicine, personalized, precise, predictive, preventive.
Yes.
This 4P medicine is based on AI technology, which is developed for 20 years. So they are pioneers in AI, in drug development. And right now they are able to design a new drug like in weeks and even faster. So we will see a lot of progress, achievement in this area right in this year.
Yes, I got it. And any other digital trend that you are observing these days, Edwards, like especially in the healthcare space?
Yeah, in healthcare space, the main trend is personalization. So you can see that this problem of
Yeah.
no one drug fits all people.
Yes.
Previously, you are going to doctor and doctor is giving you a drug, pill, and
Yes.
this pill is independent of your genomic or your other conditions. But
Yes.
it was wrong. So no one pill fits all people. So you need to take personalized approach. And now this personalized approach is adopted in healthcare, and it is available for everybody. You just can go to ChatGPT,
Yeah.
introduce your diagnostics,
Yes.
and it will suggest what drug fits you and what side effects
Yeah.
you can have based on your diagnostics.
That's superb. Now, Edwards, since you're working in the healthcare and you have a lot of idea around that, there are a few products which are building products like, ICU as a service. Because if you go to, say, a tier three or a tier four cities in a lot of countries, including India, better medical facilities are not available. Doctors are not willing to travel to these cities, and because of which a lot of morbidity basically happens. Because the time taken to transport a patient from one place to another is quite high. In that case, I was just going through a product which was doing some ICU as a service, where they will put in the entire ICU setup in a tier three city, and this entire patient can be monitored, remote monitored from any other city. Have you heard of such kind of technology in place,
Yeah,
and what are your points on that?
yeah. Such technologies are already available in European countries, in USA. And USA, you even can get insurance compensation for video call with doctor. So you don't need to go to doctor. You just make video conferencing, and
Yes.
insurance company will cover such costs. So yes, it is inevitable future of every country to transfer all medical services remotely. For example, you will get a consultation with your doctor, and
Yes.
you will get diagnostics by our checkup smartphone application, and your drugs will be delivered by Amazon. I don't know if in India Amazon is present.
Yeah, it's there. It's there. Yeah, Amazon is there. Amazon was the first company which kind of introduced e-commerce in India, I think.
Yeah, so you see, progress is inevitable. It will reach every country, every corner.
Yeah, absolutely. But one of the problems that I think which faces Indian industry, Indian healthcare industry, is the low penetration of insurance. One thing. The second thing is that, likewise, you were talking about the US. uh, you know, it kind of covers your OPD expenses, it kind of covers your prescribed medicines, expenses as well. In India, what I have seen is that taking insurance cover is easy, but getting them, kind of, uh, you know, getting your claims or also getting the OPD covered, this is still not there. Like, I'm yet to see, I think one insurance provider is there which actually covers your OPD expenses. So unless or until insurance starts covering the OPD and the medical, prescribed medicine expenses, the incentive for a doctor or for a hospital to prescribe, personalized medicines will be lesser. This is what I'm thinking out aloud. I would like,
Yeah,
I would love.
there is a solution for this issue. It is 4P medicine. If you get prediction of your health condition, you can prevent health condition. Even with food, food can
Yes,
be your drug.
yes,
For example, simple water. If you take a cup of water, hot water, in the morning, you will see a lot of improvement in your health.
absolutely.
So
Yes,
by simple communicating to people such health preventive measures, you can
yes,
help them. And if you can predict some issues years before it can happen, you easily can prevent these health issues. So in the
yeah,
such a mode, digital health can solve the problem of lack of insurance.
absolutely. And you rightly said is that, more we have come away from our roots, more we are more prone to getting, diseases like, that's kind of talking to my grandmother, and she's like 86 now. And thank God, every blood mark is like picture perfect. Like, the cholesterol levels are under control, the sugar levels are under control because she lives in a village. She kind of follows the same sort of a routine. And we guys, when we live in a city, like once we enter into our 30s, we start suffering from all the, all sorts of lifestyle diseases.
Yeah. Yeah, it is all about lifestyle, as you said. Lifestyle count for like 60% of health issue coming from lifestyle. If you have sedentary lifestyle, you definitely will have health issues. And people from villages more healthier
Yeah.
because they are doing more physical activity.
Now, Edwards, I would like to take your viewpoints on what are the main emerging trends in the fintech space, which are
Fintech,
using.
yeah. Uh, so crypto mass adoption is happening right now, and it can solve the problem of banking industry because banking is a very very conservative industry, and thanks to Donald Trump, who now is making crypto regulation
Yes.
more friendly, user friendly. So there will happen a lot of good things this year. And open banking. I don't know if in India is it in place, but in Europe, open banking, it means that you can change your bank like in second, because according to open banking regulation, you can take your information from your bank in second by just applying in digital
Yes, I got it.
wallet, and bank is obliged to provide your account information and
Yes.
to provide all services for free. For
Yes.
example, in Europe, you can transfer your money with European counterparts for free. It is called SEPA.
And this is good for the consumers as well because, they're not stuck with a single bank. They can change anytime.
Yeah, yeah. And second trend, it is embedded finance. Embedded finance means you don't need to introduce your bank card on site. It all is embedded. For example, in USA, there is PayPal, which you can send money by email.
Yes.
And embedded finance is next level. It means that you can secure using open banking, make payments and get money by just applying on the e-commerce site. No need to go to your bank site or introduce your Visa card. You just all doing embedded in your e-commerce site.
That's you're talking about that pay link, that button which comes, pay link, where you just click and the money gets, debited and it's done. You don't have to even put your card details there. Got it. And any other trends, Edwards, which you like to speak about? Fintech?
Yeah, all trends will be related to crypto because there is actually two different approaches. First is central bank digital currency, CBDC, and second approach is private crypto payment mechanism like XRP, like Hedera, and in America there is second variant now more in to be adopted. It means private systems like stable coins, for
Yes.
example, Circle, USDT, and Hedera, XRP. These systems will be used for making payments and tokenization of real world assets. For example, in a village, a person will be able to make tokenization of his land or his house and to profit from this, to get some loan or doing something with these tokenized assets.
Got it. And this tokenization is very helpful actually because
Yeah,
this
yeah,
solves a lot of.
because it is international. By taking tokenization of your asset, you will be able to get a loan from American provider of credit. And in America, it is very cheap. It is like 5% per year.
So this is very insightful, Edward. Like, so we covered about health tech, we covered about fintech, and we also covered a few applications of AI in both of them.